The Ochsner Administrative Fellowship is a 1 to 2 year program. You're able to network with leaders of the system. You're actually paired with a C-suite executive or above. Through that, you're able to get projects that really impact the system. Ochsner is very innovative. There are people who are focused on improving and elevating diversity and inclusion. We're always on the leading edge of innovation for what it looks like to deliver healthcare. For my career, it really did give me the confidence that I needed in order to become the leader that I am today.
I am Chapella Daima Swin-Lewis. I love gardening, I love sewing and costume making, but I also am a food service manager with the Howard County Public Schools. I have had nothing but positive experiences with Kaiser. I was on Medicaid when I first joined Kaiser, and now that I'm gainfully employed, I wanted to make sure that I was able to keep Kaiser as my provider. My past experiences with other HMOs through Medicaid was awful. You know, they see the Medicaid card come out and they just treat you different. You don't have a voice, you hardly have a name, you're not allowed to ask questions. It's just, this is what it is, accept it, that's it. I didn't get treated like that at Kaiser. It's, what are your concerns? How can we help you? Do you have any questions? When you're treated with dignity, you're not apprehensive about visiting the doctor's office. I have absolute confidence in my doctor at Kaiser Permanente. It makes me feel that much safer when I'm at work, being on the front line. It makes me feel that much more confident about my current health status as a parent. Kaiser is the best. That's how I feel. And I'm never leaving. I'm never leaving. I'm never leaving.
Hi, everyone. I'm Sherry Neal, Chief Diversity Officer for HCA Healthcare. And as a proud sponsor of the NACI 2021 Virtual Education Conference, I'd like to thank NACI President Fabian A. Stone and the rest of the Executive Committee for their leadership in empowering the next generation of healthcare leaders. HCA Healthcare has been a proud supporter of this conference for several years. And on behalf of our leadership, our entire leadership team, we're really happy to be a supporter again this year. Once again, NACI has managed to instill the same amazing energy virtually as the in-person conference, although I know that we really miss being in person together. You know, this past year has been incredibly difficult for our industry and our world, but I'm grateful to NACI for allowing us to stay connected to discuss solutions for some of the biggest challenges facing healthcare today. Over the past year, HCA Healthcare has raised the bar by advancing our commitment to diversity, equity, and inclusion through a more sustainable and data-driven approach. And just as we united in the fight against COVID-19, we've joined together in tackling issues that create barriers to a sense of belonging for our patients, our colleagues, and our communities. We look forward to continuing to partner with NACI to further our commitment to strengthening the diversity of our talent pipeline at all levels. Thank you, NACI, for this wonderful conference. We're so grateful for our partnership and your dedication to improve quality, access, and availability of health services to underserved communities and to expand educational opportunities for Black executives in healthcare. Now let's continue to be audacious in our actions to create a healthier, more equitable tomorrow.
Good afternoon. I'm Fabian Stone, the 28th National President of NACI. I am here today on behalf of our National Nominating Chair, Rochelle Webb Dixon, to announce the election results from yesterday. Today, we had an outstanding turnout for our elections, and I want to thank each and every one of the NACI members for your election. Now, it's that time to announce the results. As our national parliamentarian, that will be Darren Brownlee. So congratulations, Darren. Our national secretary will be Tara Abrams Stewart. Congratulations, Tara. And our national treasurer will be Carlton Ennis. Congratulations, Carlton. These new officers will be installed by our new board chair, Deborah Lietti, at the end of our public policy forum. Again, congratulations and thank you all, NACI, for a job well done. Thank you.
Good morning. and welcome to the final day of the 2021 NACI Virtual Educational Conference. Today's sessions start with a public policy forum sponsored by UPMC and planned by the Public Policy Forum co-chairs, Katrina Cherry and Willie Payton Jr. Now, immediately following this dynamic panel discussion, we'll have our installation of officers, followed by the presentation of the President's Award and the new Bernard J. Tyson Award. And this evening, there is a special bonus networking session just for the young professionals at 6:30 p.m. Eastern Time. So we're happy to see you again, virtually that is, and we hope that you enjoy all of today's events.
It basically takes 17 years to become a neurosurgeon. We work 100 hours a week, go days without going home. It's not normal. I had a lot of choices as to where I could practice. I chose UPMC because it's the home of innovation. It's an honor that when I meet a patient, I can look them in the eye and I can say, you're in the best place and we're gonna take great care of you. My name is David Okonkwo and I'm a neurosurgeon at UPMC.
Hello, my name is Laura Duncan and I'm an executive administrator within UPMC. A $23 billion healthcare provider and insurer, Pittsburgh-based UPMC is inventing new models of patient-centered, cost-effective, and accountable care. We are the largest non-governmental organization in Pennsylvania and the largest academic medical center in the country, driven forward by 92,000 team members strong, 40 hospitals, 800 doctors' offices and outpatient sites, and a more than $4 million insurance services division, the largest medical insurer in Western Pennsylvania. In our most recent fiscal year, UPMC contributed $1.7 billion in benefits to our communities, including more care to the region's most vulnerable citizens than any other healthcare institution nationally, and paid more than $900 million in federal, state, and local taxes. And since 2016, we have had an 88% increase in people of color to our executive workforce. For our COVID response, we are proud to have an extensive vaccination and monoclonal antibody program across our regions. I'm proud to have been a member of the steering and implementation teams for our community vaccine program. Since February of 2021, the highest levels of leadership at UPMC ensured vaccines were sequestered to serve our underserved communities in our local urban and rural environments. We did not falter in deploying hundreds of staff hours to ensure a seamless experience to become vaccinated for our patients of diverse backgrounds or of low socioeconomic needs. Our programs have vaccinated over 650,000 members of these communities to date. One other highlight of the advancing science we deployed to address active COVID infections for our outpatients is through monoclonal antibodies. We believe monoclonals work, and our deployment methods meeting the emergency use authorization rules are mindful of populations traditionally lacking access to new clinical interventions. Once we received this therapy from the government in the early spring, we linked our electronic health record decision support tools to identify patients for monoclonal therapies, overcoming unconscious biases that would hamper expansion of this life-saving treatments. Our efforts have created a rate of usage that shows no difference between gender, race, or socioeconomic status of clinical appropriate patients. As of the first week of October, UPMC has addressed 150 to 200 orders per day for monoclonals through emergency departments, outpatient clinics, and in-home based infusions. UPMC and our partner, the University of Pittsburgh Schools of Health Sciences, are a scientific and clinical force to improve the health of our local community and the world. We stand united with NACI in spreading the science and hope for our nation's health and well-being, especially during the pandemic. I am deeply grateful for your time and hope that you will enjoy this year's Public Policy Forum on Race and Resiliency, the State of Post-Pandemic Black America, as sponsored by UPMC.
Good afternoon, NACI. I'm Katrina Martin Cherry, co-chair of the Public Policy Forum and Vice President of Community Engagement and External Affairs at Boston Medical Center. We have an extremely robust panel planned for you today, and so we are sure at the end of this panel, you're going to have lots of questions. As a bit of housekeeping, we would advise you to find the Q&A bubble on your screen. Please submit any questions for our panelists through that bubble and not the chat. The chat is only for you to catch up with your NACI friends and to say hello, but all questions, please make sure that you put them through the Q&A. Now it is my pleasure to introduce our moderator today, Tiffany Cross. Tiffany Cross is an on-air political analyst and cable newsroom veteran. She is the author of Say It Louder, Black Voters, White Narratives, and Saving Our Democracy. She's also a resident fellow at Harvard Kennedy School's Institute of Politics. Her broad experience across media, politics, and policy includes more than 2 decades of navigating newsrooms and campaigns while engaging different constituencies on the ground. She previously served as the DC Bureau Chief of BET News and the liaison to the Obama administration for BET Networks, where she covered Capitol Hill, produced political specials, and oversaw the daily operations of the news department. Tiffany cut her teeth in media at CNN, where she worked as an associate producer covering Capitol Hill for the network's weekend show unit. She also previously served as field producer for America's Most Wanted and Discovery Communications. No stranger to the campaign trail, Tiffany not only covered campaigns, but worked on them as well. She has lent her expertise to numerous local, state, and federal candidates, as well as issue campaigns across the country. Serving as a senior advisor to one of the country's largest labor unions, one of Tiffany's many tentacles was organizing all communities of color on both a local and national level. Using her media background, Tiffany has helped shape the narrative around issues, individuals, and ideology. Leaving the campaign stump, Tiffany transitioned from the control room to the green room when she founded the Beat DC, a national platform intersecting policy, politics, business, media, and people of color. With a readership comprising influencers across the country, Tiffany led a team that made the fast-moving current affairs in a busy legislative climate digestible for the political connoisseur and the novice alike. She quickly became a sought-after voice in the progressive discourse and is a frequent guest on MSNBC, CNN, and SiriusXM. Born in Cleveland, Ohio, Tiffany left at a young age and moved to Atlanta, Georgia. She attended Clark Atlanta University, where she studied mass communications with an emphasis on radio, TV, and film, and she now currently lives in Washington, D.C. It is my pleasure to welcome Tiffany Cross as our moderator today.
Thank you so much, Katrina, for that wonderful info. I just want to make a quick addendum. I used to be a frequent guest on MSNBC and CNN and SiriusXM, but now I host my own show on MSNBC Networks, The Cross Connection, which airs every Saturday from 10 a.m. to 12 p.m. So wanted to get in that quick plug and commercial break while we were here. But thank you again for that wonderful introduction. And I'm honored to be here to serve as the moderator for the 2021 Policy Forum of NACI. I really wish that we could have been together. I think it's a different dynamic when you're with people. And I think after being isolated for so long, I don't even know you all. I don't know who's out there watching the faces on the screen, but I miss you all. But the reason why we can't be together is one of the things we're going to talk about today, and that's this pandemic that has really devastated so much of our community. So during this discussion, we're going to hear from 3 healthcare leaders about the impact this pandemic has had on our mental health, which quite frankly does not get enough discussion in the public discourse, our resiliency, health equity, and economic equity. So the most important part of this discussion will be what each of us can do to help. So first, I want to introduce you to the wonderful panelists that you'll hear from. And as I introduce them, they're going to take a few minutes to talk about the work that we do. So I'm going to start with Dr. Janet Taylor.
Thank you, Tiffany, and hello, everyone. Greetings to all the NACI members, and thank you for having me on this important panel. I am a psychiatrist based in Sarasota, Florida currently. I worked in New York for 25 years and have basically worked in underserved communities and with individuals who are criminal justice involved for most of my career, and also individuals who are addicted to opiates. And currently in Sarasota, Florida, where I am still doing community mental health and run a MAT program, medication assisted therapy program, treatment program for individuals addicted to opiates. And what the two pandemics have done with COVID-19, or COVID-16, 19, as I heard it referred to, and certainly racial reckoning, has highlighted stressors on individuals, has highlighted just how devastating an illness can be, and the importance of multiple structures, from administration in terms of how you pay for healthcare, to what happens to individuals who cannot work, who are essential workers, and certainly how it's affected our Black and Brown people. By my background, I went to undergrad medical school at the University of Louisville, did a year in internal medicine in Providence, Rhode Island, did my psych in New York Medical, and I have an MPH from Columbia. So definitely in terms of how the impact of not just illnesses on communities, but how do we incorporate prevention, especially when we're talking about mental health, which so often people just think about mental illness, but it's really about mental wellness. And as the World Health Organization says, there is no physical health without mental health. So I'm happy to be part of this conversation, and just a reminder about resilience. During this time, your brain is your biggest ally, because our bodies were built for this. And as I sit in Florida and see palm trees, which are built to resist hurricanes and high winds, and they bend but don't break, that's how we are. So it really is about finding wellness, and how do you flourish in the midst of chaos and uncertainty, which we can do, and still optimize stress. And that's what this disruption has caused, but a reminder of the use of our brain to help us make decisions, the importance of a healthy brain as we navigate these difficult times. So I'm looking forward to the panel and appreciate you all.
Thank you so much for that, Dr. Taylor. I have to say, I love your analogy about palm trees. And if I say that on air this weekend, just know I'm giving you credit in my heart. That was a wonderful analogy. Okay, we're going to keep moving. And up next is Dr. Thea James.
Thank you so much, Tiffany, and good afternoon, my NACI family and others. And thank you for the privilege to be here today. I am an emergency medicine doctor by training. I'm also Vice President of Mission and Associate Chief Medical Officer here at Boston Medical Center. And my primary, well, first of all, let me just say that Boston Medical Center is the largest safety net hospital in New England, which means that a majority of our patients live at or below the federal poverty line. So you can imagine that the majority of our patients walking through the door are coming in with downstream consequences of root causes upstream, which are, all of the things that have been created by historic disinvestment and things like that. So in my role, I'm primarily responsible for coordinating and maximizing Boston Medical Center's relationships and our strategic alliances with a wide range of both local, state, and national multi-sector partners, people in finance, education, housing developers, foundations, community-based organizations, and even government. And the goal is to partner to meet the full spectrum of what it takes for people to actually reach their full potential. And it means not just like filling gaps in the perpetuity, but by mitigating and eliminating gaps. And the ultimate goal is to foster innovative, I would say, and effective models of care that are essential for people, our patients, and our communities to actually thrive.
Excellent. Thank you so much for that, Dr. James. And we're going to keep it moving with another doctor. Well, not Dr. James, Celeste James. And I do not believe there's a relation. So I will pass it to Celeste James now.
Thank you. At least we haven't yet discovered a relation. So thank you. My name is Celeste James, and I'm the Executive Director of Community Health at Kaiser Permanente. Delighted to be here representing Kaiser Permanente, one of the nation's leading healthcare systems. We serve currently 12 million or so members across the country in our various hospitals and medical centers, providing high quality healthcare affordable health care to these members, and also working to improve health in the communities that we serve. And why that second part is particularly important and relevant to this conversation is that we really understand that healthcare has got to be more than health and medical care. We have to acknowledge that 80% of what drives health happens outside of a medical office or a doctor's office. And so we believe that it's incumbent upon us as a leading health system to address socioeconomic, environmental, and other social needs that impact our members and our communities. So I'm really here to tease out a little bit what that role is for healthcare. How does healthcare acknowledge and address health beyond our medical centers? We at Kaiser Permanente have for a number of years worked to address food systems and housing and economic opportunity and land use and all of those things that aren't traditionally thought of as health issues, but are intrinsically linked to health, either bad health or good health. And so I'm delighted to be a part of this panel to be able to talk about how and why it's so important for us to address these issues, especially in the wake of COVID-19, which is one of the reasons that so many people of color were vulnerable to the impacts of COVID-19, is because we haven't adequately addressed health and well-being in this total health landscape, looking at all of the factors that impact health and well-being.
Excellent. Thank you for that, Celeste. All right, now it's time to get into the conversation. And all of you women said a lot, and I have a lot of questions for you. So I think when I heard you speak, Dr. Taylor, about working with the addicted, that was one of the first things that struck me when the pandemic hit. When people have these addiction issues and were then isolated in their homes, how could they navigate that space during a pandemic? So talk, if you will, about some of the challenges you saw around that issue when the pandemic struck.
Well, certainly. I mean, there's no question that the pandemic highlighted exactly what Celeste James was talking about in terms of the importance of networks of structure, which have nothing to do with being in a clinic, but have to do with where you live or don't live. If you're homeless, being able to access groups, certainly one of the strongest predictors of staying clean and in recovery, knowing that recovery is basically every day, is that ability to connect with other people. So a number of my patients, some overdosed and died, but many just really miss that lack of connection, and we sometimes take for granted what it means to see someone face to face and how much support that provides. Individuals who may have swept the floor or loaded dishes and had a job which provided self-esteem, those jobs are gone. And so for many people, it was really a struggle to stay clean and sober. My clinic, which is, again, a community mental health clinic, we flipped on a dime. You never could have told me that we could have switched to telemedicine as fast as we did, but we were able to do that. I insisted that individuals still come in and give drug tests because they needed to do that, and to not do that certainly could have played a bigger factor in their relapsing. But we know that loneliness and isolation are as big a risk factor to physical health as drinking and smoking. And so trying to combat that and stay connected has been a challenge. But the pandemic really, as we know, even people who may not be labeled as individuals who are substance abusers, we know that people at home, alcohol use increased up to 20%. So how people coped during this time and still continue to cope has been critical. But for substance abusers and addiction, it's been really challenging to keep them connected, to get them into treatment if they need it. And it's an issue that we're still working with. But thankfully, it's Florida, still Florida, which has its own issues in terms of mandates and mask mandates. We're getting people back in, and I think that's really helping.
Yeah, that's been such a challenge during even before the pandemic, the disproportionate ways that drug abuse has impacted the Black community. Dr. James, I want to piggyback on something Dr. Taylor said, and that was about people, who had jobs that gave them a sense of purpose and self-esteem. You spoke about your work dealing with a lot of people who live below the poverty line, which again, when you look at the wealth gap in this country, is stark and disproportionately impacts all the folks who look like us on this screen. Talk, if you will, about the challenges your work faced during the pandemic, because like the saying goes, when America catches a cold, Black America catches the flu. Lately, it's Black America catches COVID, but please.
Exactly. It's just as you said, our patients live, they all come from historically disinvested communities, and they live below or at the federal poverty line. But let's just face it, even pre-COVID, when you looked or measured anything, I don't care what you were measuring, if you measure it by demographics, you know who's actually going to fare worse. And the thing that COVID enabled, and then I will answer your question explicitly. The thing that COVID did was to show that how we never interrogate those things. We see these data, people study disparities forever, but they never interrogate them. It's just accepted, And so we kind of were expecting this to happen. At least most of us were expecting this to happen. So it was like a rapidly rising tide, and then like a tsunami. And if you actually saw the graph of when the first patients came in, it just was just a rapidly rising trend going northward. And so again, we are the only safety net hospital in our city. And as you spoke about the wealth gap, we do have a dubious distinction in our city of being number one or number two in the country in terms of racial wealth gap. The median net wealth gap, the median net wealth for Black people is $8, and for white people is $247,000. So that sort of like sets the stage. So we were the first hospital to actually tilt over from the volume. And at one point in time, 80% of our discharges from the hospital were actually people who had COVID. And in many, many, many ways, it was almost like a history book. It was like a history book because we kept data. We had a 47-page dashboard that we kept every single day. And it was exactly like a history book because everyone knows that people who have lower income, lower education, they have lower health status, and so do their children as just mere beneficiaries of what their parents have. They have, lower life expectancy. And so the majority of our patients during that time had a high school education tops or less. The majority of them came from the neighborhoods that map of where those patients came from match the redlining map of this city from the 1930s. And actually, that's across the country, not just in this city, but across the country. The COVID maps actually match the redlining maps. And what it did for us is to enable us to, sort of like really analyze this and think deeper about it, and to really enable people to understand that as a safety net hospital, it requires more. Our role is more than just finding more elaborate ways to provide more charity for more people, because it doesn't change anybody's life. It doesn't alter their life course trajectory. It never enables them to get out of the line of need. And so it has helped us to have a sharper eye on what equity really means. And so everything that we have done, henceforth has been to actually disrupt and to really interrogate the inequities. And I want to say, we actually started with ourselves. We actually put the mirror in front of ourselves to say, where might we be complicit in doing things that don't represent equity? So it was a reckoning for us here. And in order for us to do that level of diving and looking at ourselves, we actually had to establish some principles in the beginning because we expected that we would find things.
Wow. I mean, I imagine if a wider scale, if we started with where are we complicit, in addressing inequities, you would see that cast a wide net of influence. Instead, Celeste, we see, this casting a dark shadow over so much, particularly when you get into things like, mask mandates and people who've never known actual persecution to confuse the two. And when you talk about our inequities, looking at the screen and who we have here, what inequities people have overcome, imagine if wearing a mask was your only example of being persecuted. Kind of makes you wonder why some people are so basic. But Celeste, you talked a lot about this as well. The health disparities in our community. It's not just healthcare, right? I mean, you spoke about, land use, food systems, acknowledging that it's beyond just our immediate healthcare. I think the pandemic has certainly cast a light on that. Talk, if you will, about how the pandemic has cast a light on that and what challenges you confronted when this pandemic hit and how you've been able to overcome some of those things, or at least begin to address them.
Yeah, absolutely. So, my co-panelists have said so much about one, the how COVID-19 exacerbated and amplified the disparities that exist in this country between people of color and others. And when we saw what happened, this double, triple pandemic, that it had both a health impact, incredible health impact, but also an incredible economic impact. And we saw the suffering, we saw how it immediately became a pocketbook issue for people who were already struggling. And so what we've had to really grapple with is, how do we help people to recover and to build back in a way that that we don't find ourselves here at the next pandemic or the next big crisis. So this really became both a health and economic crisis. So what we saw, of course, was a lot of information that was flowing, but not everybody was getting the information. Not everybody was getting or even understanding information that was flowing. We're finding that people were not trusting the information, and that comes from a long history of distrust of healthcare, of public health. And so we had to, again, reckon with that. How do you talk about being complicit, we had to examine ourselves and to say, well, what role does healthcare play in not being a place of trust for people of color when we need to get information to them? So at Kaiser Permanente, we spent a lot of time engaging trusted messengers from the very beginning, looking for and pulling out our physicians who are people of color and placing them in positions on panels and to speak about the COVID at the time and then the vaccine later on, but ensuring that we were really connecting to people and to people's concerns, listening to those concerns, understanding those concerns of our members, of our community members, of our employees, and really understanding the basis of people's fears about the vaccine. And so trusted messengers was a really important part of what we offered. We also, of course, had to go, as others have spoken about, to other means of making sure that people are getting information and services. We supported a number of pop-up clinics, vaccination sites. We supported, we provided toolkits to help other healthcare organizations and other agencies to be able to reach people equitably. So we were very concerned about equitable access to information, equitable access to health services, as well as ultimately equitable access to the vaccine. So I think it was really important for us to, one, look at ourselves and understand what role we have in fostering trust within our own membership and our communities, and two, how do we ensure that there's equitable access to the right conditions, to the right services, and ultimately to this vaccine. So we've had to think about many different components of this and what impact it's had on our communities of color in particular.
Celeste, I want to stick with you here for a minute because you talked about the vaccine and making sure that you had the right people speaking. And I think that's a really good point, right? Because when it comes to vaccines, the messaging is as important as the messengers. However, we still see a continual hesitancy by some folks in our community to get the vaccine. Kyrie Irving is the latest example of that. there are legitimate reasons for distrust in the health community. With the Henrietta Lacks case, I'm sure people know the Tuskegee experiment. I will say, though, when I ask people, is that your reason? Explain to me then, what was it about the Tuskegee experiment? Talk me through what happened there. Most people do not know the story. They just know this is an overarching theme that they've heard. Given that that's where we are, where do we meeting people where they are, and then expecting people to take some personal responsibility in the caring for the greater good of the community and getting vaccinated? And how is Kaiser addressing that and filling that gap?
Yeah, well, again, we have taken a lot of care to talk to our employees as well as our communities about the vaccine, about COVID-19, engaging our physicians in ensuring that we're disseminating the right information to the right communities. We also have a partnership with barbershops and hair salons. And we've been engaging in a partnership with the state of Maryland and these salons to, again, foster these trusted messengers, because we know that people are more apt to listen to people that they trust in their communities, and barbershops and hair salons and faith-based institutions are these places of trust. So that's one thing. It's really cultivating trusted messengers for every aspect of this pandemic. The second thing is that we've done campaigns. We had an extensive COVID-19 campaign that was targeted to communities of color, particularly African-American communities and Latinx communities across the country. And what we did was we provided this at this time was an information campaign about COVID-19. It was informational and educational. And we, again, worked with community-based organizations. We provided them with lots of collateral, meaning advertising and PSAs, public service announcements, and so forth. And what we didn't do is we didn't put our name on it. We wanted our community-based organizations to be at the forefront of the messaging. And so we did what we call a white label campaign and provided the resources to educate people without Kaiser Permanente's name on it, but providing those resources in the community. This was millions of dollars that Kaiser Permanente invested in this to push the information out to communities that most needed it. And then I guess the last thing I'll say is that we had an excellent conversation with one of the creators of the vaccine, Moderna vaccine, Dr. Kizzmekia Corbett. We brought her onto a panel that we hosted, and we had her explain why this vaccine came to market so quickly, what goes into developing a vaccine and putting it on the market, in hopes that we could get people to really understand the details of that and be more comfortable with accepting the vaccine. So we've tried many different methods.
Dr. Taylor, I want to bring you back in the conversation. Again, keeping with vaccine hesitancy, do you think vaccine mandates are the answer?
I think in some cases, vaccine mandates absolutely are the answer. I mean, in my opinion, if I was a state, any job that was licensed by the state, I think they should be mandated to have a vaccine unless there's a medical reason that they don't, because at the end of the day, it's about how do we keep everybody safe. And unfortunately, for some people, you have to lay that heavy hand down. But I also think it's an opportunity to understand what motivates people. It's not one size fits all. So when we can understand what an individual's motivation is to being more healthy, if that's so they can walk their child to school, so they can make it to work, understand there's a sense of purpose, then that's what needs to happen. So it's about certainly having a structure that explains health, that explains the benefit of health for all, but also taking the time to individually meet with people to understand where they're coming from. And when you're working with underserved communities, if you don't take that time, then you're in the wrong job, because we need to be able to have folks A, understand, and B, come back. From a mental health perspective and community mental health, 70% of patients who present to urban clinics or rural clinics don't come back after the first visit. Is that on them? No, it's on us. How welcoming are our clinics? How do we explain things to people? Do we pathologize them? Do we try to understand them? And I think that level of effort needs to happen with what's going to happen with the vaccine, because this is going to be ongoing. And it really is about how do we reach the most and understand what motivates folks.
Dr. James, you just heard Dr. Taylor's perspective. I'm keenly interested in your perspective here because you deal, again, with a lot of people who live below the poverty line at your clinic. I've followed very closely and covered very closely the Trump administration's response to this pandemic and the Biden administration's response to this pandemic. I'm curious from a local perspective in your work, how you feel the Biden administration has handled the pandemic and healthcare issues in general.
Well, I think the Biden administration has handled the COVID, the pandemic, as well as it has all these other things, things like the Build Back Better Act, for example. I mean, instead of just trying to, again, create more poverty, more charity and things like that, they're actually going at the root cause of things and trying to make it so that people are able to have an opportunity to live their full lives. And so I would say that the Biden administration has done a really, really good job. And I guess what I really should really highlight is that they seem to understand what the systemic barriers have been. They seem to understand what the structural racist policies and all these things are. And so everything that they have kind of created is actually going at that, not just, putting out something and hoping that it'll land well, I mean, when people talk about things like trust, for example, and you're so right. I mean, many people don't know anything about the Henrietta Lacks things or the Tuskegee thing, but they do know what happened to them when they were in the healthcare system last week. They do know what happened when they were here like 2 hours ago. And it's those kinds of things, that are really, that really drives people. Another thing I think is another example of that is, we realized we were addressing two things, hesitancy as well as access. And a perfect example of something that would not create trust and actually do the opposite is, so everyone knows across the country which communities did worse during COVID, but when the vaccine came online, that is not necessarily where the vaccine access was deployed. And the same thing happened in our city. And people recognize that, people see that, they notice that. They notice that, when there's something that impacts the entire population, they are not the ones who are prioritized when an opportunity comes up to actually help people. And so even our employees were hesitant. When we kept the data, 70% of our white employees were willing to take the vaccine. In the beginning, only 30% of our Black employees. So we really did a lot of what Celeste was naming as well, but we did a lot of that kind of work. Trina actually led the work in the community, reaching out to convening Zooms from community leaders. We would provide education, but we were asking them, where should these vaccination sites be? What should they look like? What should they feel like? And we were able to create a network of vaccination sites in the various different communities where there were none. And so at that level of intentionality, which is what I think the Biden administration is doing as well, they have great intentionality to actually address and understand what drives and creates, hesitancy and gaps and things like that, and go for that. I mean, it's amazing to me how these things, I just feel like the Biden administration has a lot of people around them and, in the administration that actually understands, what the real root causes are and understands the populations.
And that will shift us into a little bit of a policy, Celeste. There was a lot of social unrest the past few years with the George Floyd murder. We know that wasn't an uptick in violence against Black Americans, but an uptick in people having smartphones to record it. Given that, though, it did get a disproportionate amount of attention. So you talk a lot about it's not just the healthcare system, but all the tentacles that the healthcare system touches. Post-election, now that the Biden administration is in place, what policies should we be paying attention to that, again, cast a wide net to address our healthcare that is not just specifically focused on healthcare, but can help address some of the healthcare disparities that our community is disproportionately impacted by?
Yeah, thanks for that question. That's a great question. I'm going to answer it in 1 minute, but I wanted to just say one thing about the vaccines, and that Kaiser Permanente has mandated vaccines, as some other organizations have. And that was a tough decision, but a necessary decision. And we've also gone on to encourage our community partners, our vendors, and others to also mandate vaccines. So Kaiser Permanente feels very strongly that vaccines are the only way that we're going to get past this pandemic. So I did want to mention that even with the comments that I made about fully understanding why people are hesitant, because I do think that's extremely important, as does Kaiser Permanente. So on the policy front, there are so many policies or so many things that we should be thinking about. What we saw in the last 2 years related to COVID-19 and related to the incidents following George Floyd's murder is really coming down to race and economics in so many ways. And so when we think about policy, we have to look at economic policy, which is also housing policy. We have to look at food policy. I've talked about, that food systems is such an important and critical aspect of health and well-being. And so there are a number of things that we should be considering in and outside of the healthcare industry. We've also seen in recent months the talk about evictions and that people are at risk of losing their homes, losing their rental properties because they cannot afford to pay back rent or back mortgage. There's sick leave, that earned sick leave, that are policies that are important. We have environmental policies. There are so many different policies that really impact health and well-being that we have to consider. I will say that Kaiser Permanente is engaged with the De Beaumont Foundation on something called City Health, where there are 12 policy pillars or levers that we're working to help to pull. And some of those include tobacco policy. There's a affordable housing trust. Kaiser Permanente does extensive work in affordable housing and reducing homelessness. And the affordable housing part is creating and preserving affordable housing. Oftentimes that takes policy, zoning laws, looking at the way policies are made around home loans, et cetera, et cetera. So when you think about policy, it's not just health policy, it's economic policy, environmental policy, food policy. And the last thing I'll say is that we've also been working with United Way, and they have done some phenomenal research on what they're calling ALICE families. That's asset limited, income constrained, employed. These are people who are employed and are considered to be above federal poverty level, but they still can't make ends meet. So we have to look at where those families exist, why they exist in this, kind of limbo state where they are perpetually in poverty. And if their income increases even a little bit, they become ineligible for certain public benefits, which continue to perpetuate their poverty. So we've got to look at those kinds of policies that address those huge issues that ultimately impact people's health.
I want to talk a bit about, as we talk about healthcare, Dr. Taylor, I want to talk a little bit about mental health, because I think that's such a huge conversation that frequently gets overlooked. Look, a lot of Black and Brown folks have experienced this pandemic in an adverse way and disproportionate to a lot of our counterparts. We are all collectively experiencing mass trauma. And this is everything from what Celeste just spoke about, from housing insecurity, food insecurity, to addiction issues like you deal with. I guess, how do we address the mass trauma that we're experiencing? What have we learned during this pandemic about prioritizing our mental health, and how can we do that, particularly when these are always attached to us, in an effort to normalize wellness?
Yeah, I think it's a real opportunity to understand how the brain works. Because of smartphones, we have this myth of multitasking. Our brain operates the best when it can function on one thing at a time, and then you just check things off. And my suggestion is make that one aspect that your brain is focusing on you. So self-care certainly is important. It's important to acknowledge trauma, and specifically racialized trauma. Dr. David Williams from Harvard has shown that when someone is killed, an unarmed Black man or woman is killed in an area, that almost 30 to 50% of the people who live in that area, Black people, will have depression, will have missed work days, and the white people have no effect. And so what we know also about trauma is you don't have to be a direct witness to it. Just seeing it and the byproduct of seeing it, what media or hearing also is traumatic. And trauma, impacts us at the cellular level. And so what we really have to do, and as Dr. James talked about, it's access and also and it's access, and then also being able to describe and understand a diagnosis. For example, Black women will present on average 10 times to their primary healthcare provider before they're even asked how they are feeling, how they are doing. And so those levels of discrepancy mean that when Black people in particular are depressed, we're missing that opportunity to bring them in for treatment, to acknowledge what's going on. So it really means our healthcare system has to implement regular questions about mental health. And then as people of color and Black people, we have to acknowledge the fact that, for centuries, we've been told that we're superhuman and, the strong Black women, and we are not, we are individuals, we are human beings who need to be taken care of. So we need to acknowledge when things are not going well for us. We need to acknowledge what it means to feel down, but we need to do it in a safe place where it's not used and held against us. And so mental health, workplace intelligence, and Oracle did a study that showed for 86% of Americans, 2020 was the worst work year of their lives. So what does that mean as it impacts their mental health and their family's mental health, and children and going to school and the sandwich generation, and especially for people of color who may be in under-resourced situations? It's another stressor. So the level of threat is continuous, but what we have to do is break up that threat by facts. Our brain likes certainty. Our brain does not like uncertainty. So facts are, getting a COVID test, getting a mammogram, getting a pap smear, looking at all those factors, making them tangible, and then dealing with them in a way that doesn't just leave it to chance. And so there's no question that our mental health collectively as Black people in America is at a tsunami, to use Dr. James' words, but also understanding that depression, bipolar, all those mental health conditions that impact us are treatable. And so we really have to look at how we can access them, get treatment, and it gets back to trust. It gets back to racial equity, but also understanding that we are not machines and we need to take care of ourselves with self-care, but also when we need more to go to our healthcare providers.
I want to stick with you here for a minute, Dr. Taylor, because you talked a lot about mental health. I want to hone in on children, because children have been impacted by this in a different way. They've received imagery for the first time, and they're processing from seeing, a Black man get tortured to death on television, the emotional trauma in their own households, the absence of the developmental growth that they would have otherwise experienced had they been in schools, et cetera. So how do we, what long-term impact will this have on children? And how should we be prepared to deal with that?
Yeah, I can definitively say that it will have a long-term impact on our children. And what we have to do as parents certainly is check in with our children and see how they're doing, to limit their access to things that can make them upset in terms of imagery, but also realize, the time that they're away from school has really been disruptive and stressful and has caused more anxiety. What their own parents are feeling in terms of their own frustrations, whether it's a relationship or worried about finances, their own health. Unfortunately, parents have come home, and because the parents have lacked the same kind of social cohesiveness and community, have really just dislodged and poured into their children. So the children are feeling responsible for what's going on. So the mental health of our children is something that we really have to look at. So as a parent, as an adult, you want to look at their functioning in terms of how they're doing in school, how their overall reactions are to what they should be doing, but acknowledge the fact when our kids tell us they're sad, when our kids tell us that they may be anxious to not just, or be being bullied or having trouble adjusting back into the routine, to not blow it off, but take them seriously. Share with our kids how we are feeling, share with how we cope. And there's never been a more important time to continuously check in with your children and see how they are doing, because my experience has been that our kids have really suffered without the context of how to make themselves better, and to really just pay attention and have resources available, knowing that, you know, access to child psychiatry has always been a struggle and is at a low, but it doesn't have to be a child psychiatrist. It can be your primary care doc. You know, there's therapy for Black girls. There's online resources that are really important to certainly investigate and have a professional talk to your child and make sure that they're okay.
Dr. James, you heard Dr. Taylor's comments, and because you work in the community, I'm curious how you're prioritizing, or how your clinic is prioritizing the mental health of your patients, from adults and children alike.
Right, for sure, Tiffany. You know, about 70% of our patients have documented having a mental health problem. And so sometimes it's hard to know which came first, the chicken or the egg, you know, given, you know, what they have been up against for their entire lives. And so I want to highlight that prior to COVID and the pandemic, our mental health appointment show rate was somewhere around, I don't know, 30%. And during COVID, we were using telehealth. It went up to like 90 some odd percent, the show rate did. So, I mean, I think there are a lot of things to read into that. Number one, as you highlighted, is the need and the necessity. But also, I think there's something in there that shows what might work for people better than other things. I also want to say that to recognize this, I mean, I feel like medical education, actually, I know this, medical education is really not relevant to address all these things, because they teach you to, in medical school, they teach you to focus on disease. They don't necessarily teach you to understand there's a human attached to it, and the various different ways to connect to that human being, and the various different things that might be responsible for what you're seeing in front of you. So I think in our healthcare system, the mental health, we have a Black chairman of the Department of Psychiatry who has really gotten and established relationships in the community with various different partners to actually enhance, you know, the ways in which we can connect to people. So it's a big issue here, and it is really on our radar. And so, you know, and we're addressing that.
Celeste, I want to bring you in, and I want to encourage the folks who are watching. Hopefully, you're submitting questions because we will have a little bit of time for audience Q&A. Celeste, based on what Dr. James and Dr. Taylor said, you know, there are people who have mental health challenges, and you know, it's not like people are suicidal. Maybe they're just having a hard time managing life and need to talk it through. But perhaps they're uninsured. And they don't even know that there is an option to address their mental health. What piece of advice would you offer working for Kaiser? Like, what's the solution for people who are dealing with, you know, that gray area of just mental challenges that we all deal with, quite frankly?
Yes. So, you know, there are so many resources that are available within workplaces nowadays, or increasing, I should say, but probably not enough. So of course, many corporations have employee assistance programs that we advise our employees to tap into when they're struggling with mental health issues. We have lots of mental health apps now, Calm being one of them, that help us with you know, centering ourselves and grounding ourselves. You know, employers are increasingly encouraging staff members around wellness and yoga and mindfulness and all of those things. But I agree with our other panelists that, you know, so much of mental health is steeped in trauma. And so some of those things are not sufficient. And we know that there's a dearth of providers of mental health across the country. And so we're challenged. We're deeply challenged by this issue. However, there are growing numbers of telehealth and digital therapeutics and digital therapy that's available. There's an organization called Hurdle.com that I know is providing African American therapists, specifically targeting African American audiences. And so I think it's really important for us to just look at other ways to address the kinds of mental health challenges that we're seeing emerging. I will say that Kaiser Permanente for a number of years has supported mental health in schools. Teachers suffer from incredible what we call secondhand trauma because they work with children who suffer firsthand trauma. And so we've been working with these teachers across the country to provide the tools and the resources for them to be able to, one, provide trauma-informed care, and education, but also to take care of themselves and to recognize their own signs and symptoms of trauma and to be able to address them. And I will also just say to Dr. James's point about medical schools, I know that later on in this program, you all are providing an award around that's named after Bernard Tyson, our very own former late leader. We have a medical school that Kaiser Permanente launched about 2 years ago, the Kaiser Permanente Bernard Tyson Medical School, and we're precisely doing what Dr. James talked about, which is expanding this notion of what health is and training physicians that are able to address social health as well as medical health and physical health. So this is really important as we grow this healthcare industry to broaden our reach.
So speaking of coming up with different ways, Dr. Taylor, to address mental health, let's talk about these 911 calls, because we've seen trauma come out of that as well. And this new, wave of perhaps increased mental health trauma has impacted who's answering these 911 calls. So many times we see, police show up and people are calling for help, and they end up only adding to the trauma. What's the solution there? I mean, should these calls be diverted to mental health centers that are more equipped to handle that? And is that even a possibility? Can the system handle that, particularly in local municipalities where a lot of these places have shut down because of lack of funding?
Yeah, I think it's an imperative that when police are called, that social workers or individuals who are trained in mental health go with them, because I forget the exact number, but literally I think it approximates almost 75% of calls that police go to, that whether it's domestic violence or suicidality, that a mental health professional could help. And certainly the goal, what we need to do is keep people out of jails and get people into treatment. And so when you can do that before somebody has a charge, before they've been written a ticket, then get the help they need, that certainly would help. I also think issues like community policing help, where people in the community know that the person who's coming to help them will actually help them and not hurt them. My experience has been that most police officers are not bad police officers. And within a community, if there is an emergency, certainly you're going to reach out to them. From a mental health perspective, if a family member may be suicidal or acting in a way that's dangerous, I mean, the police have to transport that person to a hospital. So there's no way around that, but it really is about training and comfort on both levels. So for police, we can teach them about implicit bias and how to de-escalate in a way that's safe. So instead of shooting someone, you can calm them down in a way that's not hurtful to them or their families, and also continue to educate family members what to expect when the police are called, when to call the police. And it's really about creating a culture of safety and familiarity that will help individuals certainly get the help that they need in a safe way. But it's a real issue because Black families have been traumatized by the police. Black children are traumatized by the police. And it's really in schools, our students are traumatized by the police. And so the real concern is, how do we bridge that gap in a way that makes everyone safe, but also educates them? And it's an issue.
Right. And when people say defund the police, I think that's some of the things that they're talking about, right? Not abolish the police, but apply some of that funding to different ways. Yeah.
Push that budget to social workers, and let's keep, especially our young people, out of jails and get the help that they need.
Absolutely. So I want to ask all of you the same question. I think we're coming up on time, but I want you all to be able to weigh in on this issue. And Celeste, I'll start with you and we'll work our way backwards. Given everything that's happening, right, in healthcare, COVID, all the things that we've talked about, because there's a lot of intersectionality with these issues, what is something that you guys are paying attention to that you feel like there's not enough attention being diverted to this issue? Something that, people in your industry perhaps may be talking about that the rest of us should be focusing on. And I may or may not be looking for a segment to do on my show. So Celeste, we'll start with you and go around.
All right, well, I'll say two things. One is, of course, our own healthcare, looking in our own walls, looking within ourselves, being introspective about how we provide care, how we identify health disparities and address them specifically. So that's one thing. We have to do better at that in healthcare, and Kaiser Permanente is working on that, and I believe others are as well. So the other part of it is, again, looking at social health and integrating social health into healthcare. Along the healthcare continuum, healthcare should be able to address and has to be able to address social needs as well. In the last year, Kaiser Permanente launched a referral network to refer our members and our patients to social services when we identify that need. That's an important part of the full care continuum, and we want to be able to continue to address full social health, mind, body, spirit, and community as part of the healthcare continuum.
Dr. James?
I would say that, the past 2 years has made everyone begin to focus on equity. Every well-meaning person has hung out their equity banner and made these proclamations and things. They're going to focus on equity. But I would say that I'm not so sure that people understand inequity. And I think in order to be able to address equity, you have to understand what inequity is. And the trick about that is that inequity is hard to recognize. And it's hard to recognize because for so long it has been the status quo. It's like the norm. And people look at these things even when it's in plain sight and they don't see it. And so what I, would hope that people would do, and what I'm really concerned about is, that people will continue to do the same thing that they do without recognizing all this opportunity and resources that we have here. We have an opportunity to reset things, to not be able to predict the data outcomes like they've been for so long. But we have to understand how those things happen to begin with so that we don't, inadvertently recreate the same thing. So I think that's a really important piece that we need to focus on right now, because if you cannot and don't understand inequity, and I actually recognize more now than ever that people really don't see these things. They really don't, because it's what they've always seen and it was always normal, the status quo. And so it's hard to unpack. So I would say that I think that's one of the most important things that we have in front of us right now, if we want to see change.
Excellent. And Dr. Taylor, we'll close it out with you.
Okay. I would add that, number one, in healthcare, we get rewarded, so to speak, for identifying what's wrong with people in disease states. But we also need to be able to identify people's strengths at the very first time you see them. So how do we really reframe how we look at stress? So often we're saying stress is bad, you don't need it. But for some people, learning how to optimize their stressors so they can see where they've grown from it, what they've learned. You talk about resilience. Those factors are things that we need to train our health care providers in, because 70% of our thoughts, our conscious thoughts, are negative, 70. So how do we help people identify how to reframe those so they can keep going on? Because if you are fully participating in your life, it's going to be stressful. But if you can look at another way to identify those stressors, identify how you can push back against them and reframe them in a way that incorporates and increases your purpose, but also helps you modulate that response, deep breathing, meditation, walking, things you can do for free, then we can certainly hopefully have a healthier population who can live every day with resilience and hope, but also understand that, we can't afford to push away our stressors. We have to deal with them as they come up.
Excellent. You ladies have been amazing to talk to, and I've learned so much. And I want to apologize to the people who are dropping questions. Blame it on me and my lack of technological abilities, because there were a few questions that unfortunately we didn't get to, but the conversation has been recorded, and the organizers of the event will try to get answers to your questions. So thank you all so much for joining us. Thank you to Celeste James, Dr. James, and Dr. Taylor. This has been quite an informative conversation, and thank you for allowing me to be the person to moderate it. I'm honored to be in your company and to know you all. And with that, I believe I'm tossing it to Willie Payton. I like saying that name, Willie Payton.
Thank you again to our phenomenal panelists and our fantastic moderator and fellow Clevelander, Tiffany Cross, for this afternoon's discussion and call to action regarding the state of post-pandemic Black America. I would like to take this time to thank our double platinum sponsor, UPMC, where they're providing life-changing medicine. And it is now my honor and pleasure to introduce the 17th president of the National Association of Health Service Executives and our board chair, Deborah Lee Eddy, for the installment of our newly elected executive board.
Thanks, Willie. And thank you, first of all, panelists. It was phenomenal. We are ever in your debt. Thank you so very much. I have the esteemed pleasure of installing our very newly elected officers. And I am a little technologically challenged, so I am hoping that Darren Brownlee, our newly elected parliamentarian, is on screen. Somebody needs to tell me that he is. Okay, all right. And Chara Stewart, our brand new elected National Secretary, and Mr. Carlton Ennis, who will be stepping in as our National Treasurer. I can't see you, but I'm going to trust that this is all going on. Patrick is saying it is. So what I need you all to do is I need you to raise your right hand. This is going to sound a little garbly, so bear with me. I'm going to ask you to repeat after me, and I'm going to ask you to repeat your name and then your office as appropriate. So if you would raise your right hand. I,
Carlton Ennis. Darren Brownlee.
Chara. I didn't hear Chara. Okay. Solemnly swear to perform.
Abrams.
Solemnly swear to perform.
Solemnly swear to perform.
Solemnly swear to perform.
The duties of your office, and state your office.
The duties
of Secretary
of the National Association of Health Services Executives.
Of the National Association.
National Association of Health Services Executives.
In an exemplary manner.
In an exemplary manner.
In an exemplary manner.
And y'all, we know we got a little lag, so we'll just go with it. I pledge to perform the duties of and state your office.
I pledge to perform.
I pledge to perform the duties of Secretary.
Right. In a timely, efficient, and ethical manner.
In a timely,
manner. Efficient, and ethical manner.
To the best of my abilities.
To the best
of my ability.
I will always keep the goals.
I will always keep the goals.
I will always keep the goals.
And objectives of the organization.
And objectives
of the organization.
Above any personal.
Above any personal.
Or individual interest.
Or individual interest.
That might hinder. The attainment of these goals. Thank you all. Thank you for agreeing to serve, and congratulations. Thanks all. And I will turn it.
Thank you.
Thank you. Back over to Mr. Willie Payton Jr.
All right, I now have the distinct honor and pleasure of introducing a great video by Fabian Stone, Dana Weston Graves, and Brian Wolford.
Hello, I'm Fabian Stone, the president of NACI, and I'm joined here today with Dana Weston Graves and Brian Wolford, our National Educational Conference co-chairs. For most of you, you have enjoyed the 2020 Virtual Educational Conference that likely was the highlight of your entire time during the pandemic. First, I would like to thank both Dana and Brian for their outstanding leadership around our virtual conference and what they've done in 2020 and what you're going to see here in 2021. A lot has gone into preparing these conferences over the year, and specifically the last 2 years around our face-to-face. So what I want to do today is let you hear a little bit from the leaders that actually made this happen and talk a little about their lessons learned and things that we should look forward to in the future. With that said, without further ado, I'll get you to get to know our two leaders. So one, Dana, I would like for you to tell us a little bit more about yourself, what chapter you belong to, a little about your hometown, just more so that the audience gets to know who Dana Weston Graves is.
Sure. So I am Dana Weston Graves, born and raised in the great city of St. Louis, Missouri. I was in the North Carolina chapter of NACI for 15 years and just recently transferred into the wonderful Virginia chapter of NACI.
Wow. So Brian, tell us a little bit about yourself.
Absolutely. Well, good morning, good afternoon, everyone. And as you shared, my name is Brian Wolford. I am originally from a place that I call the real DC, you all know as Denver, Colorado. And I am a member of the North Carolina chapter. I've been a member of the North Carolina chapter for 11 years now.
Okay. So a little bit more. So tell me, just because you've both been a member of NACI for a little bit, tell us a little bit more about how NACI relationships have impacted your life in terms of your career, and a little bit about how that helped you during the planning process of this, of the virtual conference. So Brian, we'll go with you first.
Yeah, sure. So, NACI has been foundational to my career in so many ways. I depend upon mentors, mentees, peers, colleagues who are NACI members to be very candid with me, to help guide me, coach me, support me throughout my growth. And that has also played a significant role within our planning for the conference. I think about how our relationships have really helped with 360 degrees of our planning. I think about the NACI members that advised us and supported us when we were planning for an in-person conference. I think about the tremendous teammates and colleagues who serve as conference co-chairs, many of which Dana and I have had relationships with for many years. And I also think about the impactful programming and the speakers that were either colleagues within NACI or referred to us through relationships throughout NACI.
Yeah, I echo everything Brian said. NACI has been so important to my career, not just from the mentors that I've been able to have, but so many of the opportunities that have come my way, and then just lifelong friendships that I have developed. NACI is a family, and when you are serving in this role as conference co-chair, you draw on those family relationships for sure. So our NACI family is so well connected. So using them to connect us with speakers and other resources, to having to call on folks at the last minute to step in when we have faced any of the numerous things that come your way when you're planning for a large conference. So NACI relationships are really the beauty of NACI, and Brian and I are so fortunate to be longtime members of the organization.
Wow, that's good to hear, and it's always, I agree with you that NACI is just the place to be, and it has been an invaluable experience for me as well. So one of the things that I wanted to talk about is during your planning of the virtual conference, what was one of the most unique aspects of that from your perspective? And I'll go with you first, Dana.
Sure. So one of the things that made planning the NACI conference in particular unique is that what our members value most about NACI is that face-to-face connection. They value the traditions. We value the way that we've done it. And so what Brian and I were tasked with was losing that face-to-face connection, but still providing something that felt worthwhile, that felt like a good use of our time, and that still brought us together. And that was a really tall order. But we found ways to do it. We found ways to do it utilizing the platform. Folks had a whole lot of fun with the chat section. We found ways to do it by really incorporating familiar faces onto the NACI panels more than I think we've done in the past, to give us that family chat kind of environment that we're used to in the face-to-face conferences. But overall, it was an opportunity for us to try something new and to perhaps learn some things that we'd like to continue doing in the future.
Yeah, I think Dana hit the nail on the head. You know, we spent a lot of time thinking and working through how we would honor NACI's culture while keeping all of our teammates and all of our fellow members safe. You know, we wanted to create interactive programming that also fed the souls of our members. And I think I can speak on behalf of both Dana and I, just sharing how proud we are of the outcomes from these 2 years.
Okay. And it's impressive what you've done, and we had a good turnout last year, and we're expecting a good turnout this year. So what was one thing that you encountered that was unexpected outcome of the 2021 conference or 2021? And we'll start with you, Brian.
Yeah, you know, I think one of the things or lessons learned from 2020 is just a direct result of our environment and you know, thinking about Zoom fatigue, virtual event fatigue from the fact that everybody was virtual in 2020, whether it was through their professional lives or their personal lives. And so in 2020, we were very thoughtful about having a conference that extended across a number of months and really wanted to be mindful of that virtual fatigue and compact this year's conference in 3 days, just and do it in bite-sized pieces of everyone's day to be mindful of any Zoom fatigue or any virtual fatigue that occurred year over year.
Agree. I think that was really the biggest thing that we changed from 2020 to 2021, which was hard because there's so many of our forums, like the women's forum and the men's forum, that we love, but felt that our members really would benefit more from a shortened, really high quality, compacted 2-day schedule. But what we also took away from 2020 that I think we will use in future years going forward is that we can do more programming throughout the year. We put on an event every single month that people joined us for. We can continue to do that for our membership in future years. So how do we take perhaps the Women's Forum and connect it to maybe Women's History Month? How do we do education sessions throughout the year, perhaps expanding to not just virtual content, but also podcasts? It gives us the opportunity, and I think what we can take away from this is we can move beyond some of the traditional face-to-face programming that we've done and offer some really high quality content to our members throughout the year going forward, even when the pandemic ends. So we're really excited about that takeaway from 2020.
Wow. I mean, you all definitely did some innovative things for us and our organization. So we definitely, again, appreciate your leadership. So one last question is thoughts or advice for next year's conference co-chairs. What would you tell them? Because we will be going in, the hope is that we will be at a face-to-face. So it's going to be a big change again. So what are your thoughts? I'll go with you, Dana, and then we'll turn it over to Brian.
Sure. So my thoughts or my advice, one, I really hope that the co-chairs have a good friendship with each other, if not develop one. Brian and I have spent more time laughing over the last 2 years than anything else. And you really want to have a good, strong working relationship with your co-chair. Use your NACI resources and then be willing to do something different. I know that we all value our NACI traditions and we want to keep those, but it was a lot of fun to be able to think outside of the box. And I don't think that we should lose that when we go back to in person. So I would really encourage them to think about some ways that they could do things differently.
And I think Dana touched on all the critical points. I would just add that it's an incredible opportunity because this will in fact be Nasi's homecoming. We haven't had the chance to interact in person for 2 years, and so there will be a lot of people excited for whatever you all have planned for us next year, including Dana and I.
Wow. So I want to thank both of you for your outstanding leadership during our conference in 2020 and our conference here in 2021 that's virtual. So at this time, Dana and Brian, as the 2021 president of the National Association of Health Services Executives, I am humbled to bestow the 2021 President's Award to you both for your outstanding leadership, for your commitment, and you took our organization from one place to a whole nother level. And we appreciate that. And I wanted you to know that from me and the entire organization. So again, congratulations on the 2021 President's Award. Thank you. I will give you both a moment and then have you both say some comments, and then I'll read to you what the plaque will say that you will receive. So I'll go with you first, Dana. Any comments?
First, I will say it is not often that I am speechless, but I just want to say thank you, Fabian. Thank you for giving Brian and I this opportunity. It's truly always a privilege to serve NACI, and recognition is never expected. We just appreciate your leadership and thank you. Thank you very much.
You're welcome. Brian?
I would just echo what Dana said and start with my personal gratitude, and you know, would do it again 1,000 times. It was an incredible journey, incredible opportunity, and really thankful for you, the board, the leadership team, for trusting Dana and I with this incredible opportunity to serve.
You're certainly welcome. Again, congratulations. And what you will receive is, it will say the National Association of Health Services Executives President's Award, presented to Dana Wessons Graves and Brian Wooford in recognition of your continued commitment to the goals of NACI for the outstanding contributions to the healthcare industry and to the future of excellence in quality and equality of healthcare services. October of 2021, Fabian A. Stone, National President of NACI. Again, congratulations to you both, and it is a well-deserved award for you both for your outstanding leadership. I can't thank you enough personally, and I know the board and the association definitely thanks you for your hard work. So thank you both.
Thank you.
Thank you.
You're welcome.
Hello, NACI family. This is Corwin Harper. I am in transition moved from California to Louisiana, so I don't have on a suit and tie today, but please excuse me. And my wife said, of all things, you gotta support the NACI family, so family will understand. And on this day, we are presenting the Bernard J. Tyson Award for Leadership to NACI. I just want to thank the NACI family for thinking enough to create an award in honor of the late Bernard J. Tyson. NACI has created this award to honor the legacy of Mr. Tyson, the chairman and CEO of Kaiser Permanente. The Bernard J. Tyson Award is one of NACI's newest and most prestigious honors. The award was created to recognize leaders and/or organizations who have made innovative, outstanding, and lasting contributions that have advanced and developed African-American healthcare leaders and elevated the quality of healthcare services in underserved and minority communities in alignment with the mission and vision of NACI. So now, please join me in congratulating this year's Bernard J. Tyson Award recipient, Dr. Reginald J. Eady, President and CEO, Trinity Health of New England, Along with upholding the organization's mission, President and CEO Reginald Eady lives out the organization's core values of reverence, commitment to the poor, justice, stewardship, integrity, and safety in his everyday work. And I know that if Bernard was here, he'd be saying, right on. To that point, a couple of examples. A pillar of Dr. Eady's work is focused on serving the vulnerable populations, an effort that's been evident throughout the COVID-19 pandemic. He's also driven partnerships and community-based organizations to provide mobile COVID-19 testing. He also has his own process of education through explanation model that speaks to thousands of community members and community partners via virtual talks to provide better understanding of the resources available during the pandemic. As for his background, Dr. Eady began as an emergency medicine physician, later transitioning into leadership, taking on various roles and collecting a long list of accolades. He was named to the list of the top 100 physician leaders of hospitals and health systems by Becker's in 2013 through 2015, was a recipient of the Walter E. Douglas Humanitarian Award in 2011, and was named to the list of the 25 most influential Black physicians in Detroit in 2011. He's written publications to highlight his passion for total wellness and healthy eating, along with How to Eat and Live Longer, a spiritually inspired guide to direct African Americans into a life of peace, good health, and longevity. And I could go on and on and on about his accolades and the things that he's accomplished, but I just wanted to say, before I hand it over, Bernard would be pleased, and Denise, Bernard's wife, would also be pleased in the selection of Dr. Reginald J. Eady for this wonderful award.
Dr. Eady's not able to join us, but we certainly celebrate him on this wonderful award. And we appreciate you, family, for making the time to make this presentation, Corwin. Thank you so much, and safe travels. Up next, our second education session, Leading Through Crisis, Management Perspectives from the Front Line, immediately following this at 2:30. And then, of course, our Young Healthcare Professionals Networking Forum this evening via Zoom at 6:30 p.m. And please do not forget, from November 10th and November 11th, the 26th annual Everett V. Fox Student Case Competition will take place virtually. Scholarship awards will be announced on November 12th. NACI family, thank you again for your participation this afternoon. Stay safe and don't let anything stand in your way. There's no stopping us now.
Thank you.